بسم الله الرحمن الرحيم. السلام عليكم. شباب, today we'll discuss the disorder of the urethra. As you know, the urethra is the tubular structure that extends from the bladder neck to the meatus, and it is in female about 4 centimeter, and in male it is about 16 centimeter. In male it is divided into two parts, the anterior urethra and posterior urethra. The anterior urethra composed of the pulpar and the pendular urethra, and the posterior urethra is the membranous and the prostatic urethra. In this lecture, we will discuss the disorder of the urethra. At first, we start with the urethra posterior urethral valve, and the most common stenotic area, or the narrowing area of the urethra, it is the meatus. So when we ask about the most common site for urethral narrowing, it is the meatus, external meatus. So as the urologist said, when there is an instrument that passes through the urethra meatus, can reach to the upper system. Okay, roughly. Sometimes the patient presented with posterior urethral valve. So what I mean by posterior urethral valve? It is the second most common, or the second most common obstructive lesion in infant and newborn, occur mainly in the male and are found at the distal prostatic urethra. Most common occur in male, or occur in male only. تقريبا نقدر نقول occur in male only. This valve are mucosal folds that look like thin membranes. They may cause varying degree of obstruction when the child attempts to void. Classification. This is considered a types of posterior urethral valve, or a classification of it. Type 1, 90 to 95% of all type of posterior urethral valve. The valve extends from the vernamentana to fuse anteriorly. Type 2 extends from the vernamentana to bladder neck. And type 3, a ring-like membrane found distal to verro. Diagnosis. دائما هذا الكيس نعطي لكم اياه، خاصه بالامتحان الاورال نسال عليه. نقول لك patient with history that his mother, when seeking the medical advice, you know that the mother go for the antenatal care, regular antenatal care, and during that the radiologist or the doctor that follow this case said that there is oligohydramnion in the mother. Mother complained from oligohydramnion, and baby have bilateral hydrourethronephrosis. This gives us an idea about the obstruction of the urethra. So the most common obstruction is the posterior urethral valve. Okay. Newborn and infant presented with newborn baby. دائما هاي الكيس تجينا newborn baby يجيك للطوارئ الأطفال أو يجيك للخدج دائما يقول لك this baby complain from respiratory distress, palpable abdominal mass or ascites, failure to thrive, seem to like there is an electrolyte disorder, or there is an dehydration, and reluctant to feed. So this presentation of the patient with posterior urethral valve. older children, recurrent UTI and weak stream, sometimes incomplete emptying of bladder and incontinence. Also, may sometimes the patient present with VUR, vesico-urethral reflux, vesico-urethral reflux. So it is considered type 2 or of vesico-urethral reflux. As we said in the previous lecture, that there is an underlying cause for this reflux. So the posterior urethral valve is a type or is a cause of this reflux. Now, what we do for this patient as investigation? Investigations, we can benefit from ultrasound and voiding cystoscopy. In the voiding cystoscopy, as you see in this picture, there is an dilated posterior urethra and valve leaflet sometimes appear, and thick bladder neck, some hypertrophied bladder neck, hypertrophied bladder neck. Sorry, this picture نخليها ببالنا هاي الصورة يسموها key hole sign. key hole sign. هاي key hole sign من جايتنا؟ إذا تتذكرون هاي المفتاح القديم، مفتاح دائما يطلع صورته بالأفلام القديمة ولا اللي هو يصير يعني دائرة لفوق أو اسطوانة وبنهايتها فهذا يسموه الكي هول ساين. كي هول ساين. هذه صاير عندنا شنو؟ نشوف بالنهاية مالتها، النهاية هو البوستيريور فالف. لفوق عندنا dilated prostatic urethra or posterior urethra، عندنا hypertrophied bladder neck and dilated bladder. Okay. Bladder, isotope is renal scan, assess renal function, and also video urodynamics to diagnose associated voiding dysfunction. Treatment. At first, we should do the general aid of this patient. Okay, now we will just complete the treatment of the bladder drainage. So at first, we should do the general aid of the patient, stabilize the patient, so drain the bladder either by insertion of the polycatheter or by suprapubic drainage of the bladder. If boy born with suspected posterior urethral valve, then treated by drainage and if possible immediate BCUG and drain, okay, either by suprapubic or by Foley catheter. And then after stabilization of the patient, when the creatinine normal, electrolyte normal, and the patient starts feeding, and at that after stabilization we can do resection or transurethral resection of the posterior urethral valve by using of the resectoscope. Okay. Sometime we wait the patient until reach older, so do vesicostomy. Vesicostomy is an opening of the urethra, of the bladder, complete fistula or create and fistula between the bladder and the skin of the abdomen. So the urine pass easily through this vesicostomy and evacuate the bladder, so we can protect the upper urinary system. Okay. Urethral structure. The second topic, it is the urethral structure. Is an area of narrowing in the urethra caliper due to scar formation in the tissue surrounding urethra. It is either congenital or acquired. Most acquired structure are due to urethral structure شباب it is an area of narrowing in the continuity of the urethra. The area of narrowing come from either it is congenital or acquired. Most common form of acquired urethral structure either by inflammation, which come from infection, or by external trauma. The most common cases of the urethral structure come from the urethritis that come from gonorrhea اللي هو gonococcal infection. The second most common cause it is the external trauma. It could be stradal injury, direct injury to the urethra. stradal injury شلون يصير عندنا شباب؟ واحد يمشي مثلا شارع مطر وما يشوف الطريق جوا ومي فينزل مثلا اكو سويج تريتمنت بلانت اللي هي يعني يعني بلوعه مفتوحه فتنزل رجل تسجل والرجل الثانيه تبقى برا فيصير direct trauma on the perineum. It is called the stradal injury. It could be stradal injury, blow to the pulpal urethra or iatrogenic during the instrumentation. Urethral structure are fibrotic narrowing composed of dense collagen and fibroblasts. These narrowing restrict urine flow. The bladder muscle may become hypertrophic and increase residual urine may be noted. Severe prolonged obstruction may lead to reflux and hydronephrosis and renal failure. Urethral fistula and periurethral abscess commonly develop in chronic severe structure. Complication. Chronic prostatitis مريض عنده urethral structure وهامل نفسه ما يراجع او يراجع وينطو والله عنده infection عنده شيء بس يعني not solve the real problem or not the real problem continuous urethral structure طبعا يحاول he try to urinate so he increase the pressure يحاول يعصر نفسه حتى to pass urine. this increase in the pressure راح يفاقم الشغله، يصير عندنا هايبوتروفايد بلادر، يصير عندنا بلادر ساكيول، يصير عندنا ممكن دايفرتيكولي، ممكن كله لانه he try to avoid against resistance of the structure. كل ما يزيد الضغط راح يصير عنده مشاكل ومرور الوقت تبدا عنده الكومبليكيشن. ممكن يصير عنده كرونيك بروستاتايتس، سيستايتس، كرونيك يو تي اي، دايفرتيكولي، urethral fistula, periurethral abscess, and vesical calculi. It is the complication of the urethral structure. A clinical finding: voiding symptoms such as hystensia, poor stream, both void and dribbling, low flow rate. يقول لك والله دكتور اني ابو القطرات او ابو مثل الخيط او ابو اللي يصير عندي يعني ينشطر الادرار مالتي يصير خطين. فكل هاي الشغلات ممكن هي presentation of the patient with urethral structure. And also sometimes the patient come with complete retention ممكن okay. Investigation. Uretherogram or it could the retrograde uretherogram اللي هو RUG show location and length of the structure. Real-time ultrasound. It is a new trial for finding of the urethral structure, especially if it is anterior urethral structure, by find the it by ultrasound, the fibrotic segment. Also, the MRI very important in diagnosis of this structure, and the real diagnosis by endoscopic examination. Treatment. At first, we try to do dilatation. طبعا يعني هسه حديثا dilatation كلش قللوا من اهميته انه مو كيوراتيف. dilation, we try to do fracture and this is scar tissue. يعني احنا عندنا scar tissue نسوي dilatation بهاي المنطقة ونحاول بهذا الدايليتيشن نسوي يعني نسوي فد fractures in this segment or fibrotic segment. But this a previous method for treatment, and it is sometimes it is obsolete because it is it is considered obsolete because almost always the structure return after dilatation. So the definitive treatment, it is either by the endoscope, urethrotomy, under vision urethrotomy, or by surgical reconstruction. هذا طبعا الموضوع يعتمد على length of the structure. Length of structure. If length of structure less than 1 and 1.5 cm, we can treat it by under direct vision urethrotomy or by scope and try to open this structure. But if it's more than 1.5 cm, it needs surgical reconstruction. Okay. The third topic is the hypospadias. Hypospadias. What we mean by hypospadias? Hypo mean below. Spadion mean oris. The condition in which the urethral meatus open on the ventral side of the penis, proximal to the tip of the glans penis. Okay. طفل جيب لك اياه newborn baby. والله هذا البيبي الاوبننج مالته below its normal position. By examination you see the opening below its normal position and abnormal skin يسموه hooded skin. هسه نشوف the shape of the penis. It consists of 3 anomaly. هاي نشوفها شباب. Abnormal opening of the urethra meatus anywhere located from the ventral aspect of the glans to the perineum. يعني urethral meatus أو urethral opening راح نشوفها along the ventral side of the phallus or of the penis, but below its normal position ممكن أن تكون من below the glans يعني من الكورونا mid shafts or proximal shafts or penoscrotal or scrotal, and sometimes it is perineum. Abnormal ventral curvature or of penis يسموه كوردي. نذكر هاي الكلمة شباب. شنو كوردي؟ called abnormal curvature. The penis curved ventrally. The penis curved ventrally. So it's good cordy. Abnormal distribution of the skin يسموه hooded skin. Hooded skin اللي هو ventral surface of the glands not covered by skin. هاي يمكن سامعينها بالمصطلح العام او سامعين يعني هن يقولون هذا البيبي عنده طهور ملائكه مو؟ فهذا هو هذا الهايبوسبادياس انه السكن البينال سكن يكون شكله هودد. شنو هودد؟ شنو الشكل هودد يعني شايفيها هاي الهات مالت مال روبن هود فمن عندها جايه الهات هودد يعني جايه فولد من جهه واحده والجهه الثانيه ما بيها تتذكروها القبعه مال روبن هود نفس الشيء نفس الفكره من عندها. اوكي. Classification according to the location. نشوف هنا شباب شلون صار عندنا بهاي الصوره واضح. هذا الجلانس بينس وهذا الشافت هذا السكروتوم. الاوبننج شلون تصير هنا منطقه يسموها الكورونا، اذا نزل يعني على الكورونا او بلو كورونا. هنا الكورونا سب كورونال ديستال شافت ميد شافت بروكسيمال شافت. هنا عندنا البينو سكروتال، وهنا السكروتال، وهنا البرينيال. type of the hypospadias. Okay. Assessment. Patient with hypospadias should diagnose at birth. Associated with assess the association of anomaly. Sometimes there is an anomaly associated with hypospadias. يجي عنده مثلا undescended testis, inguinal hernia, severe hypospadias or hypospadias with uni or bilateral cryptorchidism or penoscrotal hypospadia should have chromosomal study to exclude intersexuality. اوكي، خليها ببالنا بالامتحان احتمال تجينا يقول لك اذا فد بيبي عنده الهايبوسبادياس وبايلاترال undescended تيست شو نسوي؟ فلازم نسوي له chromosomal study to exclude the intersexuality. Treatment for a psychological reason, hypospadias should be repaired before the patient reach the school age. In most cases, this can be done before the age of 2 years. The last topic is the epispadias. Epispadias. شفنا الhypospadias الاوبننج صايره ventrally وجوا النورمال بوزيشن. epispadias شنو؟ The urethra is displaced dorsally. بالعكس. The urethra opening يصير dorsally on the dorsal side of the penis. Most females with epispadia are incontinent. طبعا بالفيميل من يصير عندنا ابيسبادياس اغلبهم هم جايين بالابيسبادياس بلادر اكسستروفي. بلادر اكسستروفي فتجي يعني كانه سندروم او اللي هو بلادر اكسستروفي البيوبك بون اوبن اور سيبريتد and the epispadias. طبعا تريد مالتها باي سيرجري. اوكي. Phimosis. What I mean by phimosis is a condition in which the contracted foreskin cannot retract it over the glands. Chronic infection from poor local hygiene is its most common cause. Calculi and squamous cell carcinoma may develop under the foreskin. Phimosis can occur at any age. Edema, erythema, tenderness of the prepuce, and the presence of purulent discharge are usually presentation. Treatment. The initial infection should be treated with broad-spectrum antimicrobial drugs. The dorsal foreskin can be slit if improved drainage is necessary. Circumcision should be done after the infection is controlled. The last topic is the paraphimosis. Paraphimosis is the condition in which the foreskin, once tracked over the glands, cannot replace in its normal position. It regarded as urological emergency. This is due to chronic inflammation under the redundant foreskin and formation of tight ring of skin when the foreskin retracted behind the glands. The skin ring causes venous congestion. Treatment consists of manual compression of the edematous tissue and subsequent attempt to retract the tightened foreskin over the glands. Dorsal incision of constructive ring may be required or circumcision. Paraphimosis, dear students, paraphimosis, it is considered an emergency condition. An emergency condition. شلون تجينا الكيس شباب؟ ودائما شلون يسالنا بالامتحان بيها، يقول لك we have a baby presented to casualty complain from painful penile swelling redness edematous ugly looking. The family gave an history that the baby is not circumcised. هم يقولوا لك انه هو ما مسوي له سيركمسيجن، احنا ما مسوي له سيركمسيجن، بس تجي تباوع عليه شوف الجلانس طالعه ولوك لايك سيركمسايزد. زين وين راح الفورسكن؟ الفورسكن اتريتراكتد باكورد، راجع لورا، ومسوين compression ring compromised ring on the glands. So this will cause edema because the venous drainage not retain blood and cause ischemic painful ischemic painful ring. يعني شلون راح يصير كانه مخلي عليه شو نقول مخلي عليه باند مخلي فد باند constricting باند مثل اللاستيكه لازمته constricting باند اللي prevent blood supply to the glands. So it is considered emergency condition. مجرد ما نجي يعني نفتهم من اهله انه هو baby not circumcised، فنفتهم انه السكن راجع لورا. treatment مالته try to decrease or squeeze the edematous tissue. سوف الضغط عليه. طبعا ممكن اكو عندنا طرق مختلفه، اما تيجي تسوي له فد برشر، ممكن نسوي له فد ايس باك يعني فد ثلج او نخليه على المنطقه حتى الاديمه تروح، وممكن sometime نقدر نسوي فد puncture by needle puncture. Try to squeeze the fluid and try to return the skin to its normal position. If it is not succeed, we can do dorsal incision. يعني نيجي على جهة الدورسال الconstricting ring نسوينا بها فد incision and try to open this ring and return the skin to its normal position. This condition it could a paraphimosis and is considered an emergency condition. Okay. The last topic is the circumcision, routinely performed in some countries for religious or cultural reasons. There is a higher incidence of penile carcinoma in uncircumcised male, but chronic infection and poor hygiene are usually underlying factors in such instance. Circumcision is indicated in patients with infection, phimosis, and paraphimosis. Okay, thank you very much. If you have any question, you can put it in the classroom. Thank you, dear.